learn a lot about how patients can actually be involved, as I mentioned, both in their own healthcare, as well as sort of in the healthcare system, giving their voice to inform things like policies, to inform things like how services can be designed. Healthcare seemed to be changing and actually interested in what patients' experiences were and what they needed, which is how I sort of came to Patients Canada. I read about a group that actually wasn't doing advocacy, so not patients against the system and the system is terrible and we need to fight back, but how can we actually collaborate with the other people and other stakeholders, they might say, in the system to actually help each other make this work better. So before I jumped right into actually doing work with them, I wanted to learn a little bit about why. Why should patients be involved in their own care now? Why hasn't it always been this way? Why is it that in history there was experts and they told patients what to do and then patients did it and that was the model and it seemed to be okay? So why is it different today? And I felt like it was really important to kind of ground what I was doing in some logic, not just because it was a nice idea that patients should be involved. Which is why I actually want to do that with you today. So I think all of you are interested in self-management, obviously, and how to make your experience with the healthcare system better. But I always think it's nice to sort of think about, what, actually my voice matters beyond just the fact that morally or sort of ethically it should be that I should have a voice, but actually because the reasoning that it makes sense and that it's actually helping both the healthcare provider and myself. So if we look at actually some of the facts, before 1850, so sort of 1900s, basically the leading cause of death was infectious diseases, a type of disease which we call an acute disease. So things like these terms, cholera, tuberculosis, smallpox, these are what people were actually dying of. And so the problem for healthcare was, how are we going to fix this? People lived only to 35 or 40 years. They weren't actually living long enough to develop a lot of the diseases we see today that we call sort of chronic diseases they were actually usually getting sick before then. The focus also, of course, of healthcare then was on creating cures, just fixing things, be it vaccines or surgical techniques. It was about fixing that situation and then sort of moving on, not about helping someone manage something over their lifespan. The healthcare system did a wonderful job to build around the issues of the time. However, today's challenges are actually quite different. The actual issues the healthcare system is facing are what we would call chronic issues or chronic diseases. I have some facts again. Almost 90% of the deaths are actually due to chronic diseases. We actually often consider cancer a chronic disease now because a lot of people do live with cancer over a long time. Heart disease, diabetes, lung disease. This is just an example of a few. Less than 3% of deaths are actually due to those acute fixable diseases. And almost everyone over 65, note there are a lot of people now over 65, whereas there previously weren't. Almost all of them have at least one chronic condition, and many of them have more than one chronic condition. And so if we look at the model of health, and I have a picture over there, which is it's much more sort of holistic model. Health exists in the context of in the healthcare system, outside of the healthcare system, psychological considerations, all of these things. Whereas before, it was kind of, I'm going to fix this specific problem and cure it.